I'm a neonatologist. I take care of babies who are born prematurely. And across the state, we have 5 regional perinatal centers, which means that babies are directed to the hospital, to the center that best meets their needs. As a result of regionalization, it's been well demonstrated in the literature that infant mortality, or neonatal mortality more specifically, is improved, and sometimes significantly improved. In one report, there's a 5-fold improvement in mortality when babies are born at a high-level center in a regionalized state. The South Carolina Neonatal Medicine Consortium is an organization of regional perinatal centers led out of MUSC Children's Health with the goal of reducing very low birth weight infant mortality. The consortium consists of 5 centers. South Carolina is a regionalized state. Regionalized perinatal center has been definitively shown to reduce infant mortality. The representatives to the consortium from MUSC Children's Hospital include myself, as well as Julie Ross, who is an assistant professor in the Division of Neonatology. She is also the medical director of our neonatal intensive care unit system, as well as Jim Kiger, who is participating in one of our very low birth weight projects, that being the standardization of respiratory care for VLBW infants.
Well, I'm very excited about the work that our researchers in nutrition have done. Carol Wagner and Sarah Taylor have really made great strides in helping us improve the nutrition of the preterm babies here in the NICU. Some of the things that we work on are early nutrition, both IV nutrition in the delivery room and as quickly after delivery as possible, as well as really working to provide breast milk early to our infants. We know that with optimal nutrition, our babies will grow and will have a better chance at a wonderful outcome. We do know is the better nutrition that we can provide to these babies, the better chance of having good neurodevelopmental outcomes at age 2.
MUSC and the consortium have done some great work to improve very low birth weight mortality in South Carolina. However, it takes a team in this population to really move mortality figures. South Carolina has a lot to be proud of. We've been able to move our very low birth weight mortality rates more than the rest of the country. And we've made great progress, but this progress really resulted from a number of different collaborations. There have been collaborations between members of the South Carolina Neonatal Medicine Consortium, sharing of ideas, sharing of processes that work, and refining those processes that don't work. In addition, we have great obstetricians and maternal fetal medicine personnel. The development of an advanced fetal diagnostics center is going to be a tremendous help to South Carolina and improve mortality among that vulnerable group of patients. At MUSC Children's, we are really looking forward to the process by which the current Children's Hospital will be replaced and a new Children's Hospital and Women's Pavilion will open in about 5 years. We are currently planning on expanding what we are capable of doing as more space becomes available, both in terms of the number of patients we can see, as well as the types of opportunities we can provide for parents and families in that center. Parents and families have an essential role in the outcome of their children. That is only now being recognized, and with the new center, we will be able to tap that resource and further improve outcomes in this group.